Organopathy. You all are aware of this term and we have heard it a lot, and we have this idea that this entire term organopathy was brought in front of the homeopathic fraternity, especially by James Crompton Burnett. Of course, it was James Crompton Burnett talks about Rademacher. He was the first person. Actually, he was not the first person. It was Paracelsus who was the first person who coined this term, and then slowly and steadily Rademacher took charge and he went into deeper studies. And of course, when Burnett came, he was very much influenced by it. Now, when we read Burnett's philosophy, many a times we have this understanding that Burnett was a very specific prescriber. He kept on prescribing on very specific organ remedies, seat of action remedies, very specific remedies. And the idea of organopathy, the idea is that it is the remedy that works on the seat of action. Whenever the remedy is given on the basis of seat of action, that is organopathy. And many times there are different schools of thoughts which talk about this. Sometimes they ridicule it. There are some groups who ridicule it, who don't believe in, and there are some groups who take it as a foremost weapon for their practice. And let's talk about Burnett. Basically, what was Burnett's idea? Was he really a prescriber who always focused on organopathy, and for him organopathic drugs were at the top? Was it exactly like that? What was his role of people who were taking totality of symptoms, who were prescribing on general symptoms? What was his views on that? So of course we have heard in tumors, because when you go and read Burnett's tumor introduction, where he vehemently criticizes the people who were criticizing him for using change of remedies and other stuffs. So he seems to be have a contradictory idea, or like he things are portrayed like he was an enemy of totality of symptom. But my dear friends, it's exactly not like that. And I'm here to quote a book. It's a wonderful book, Diseases of Spleen. You all can go and read this. I would talk about organopathy from preface of Burnett. What was his idea about organopathy and what was his views about totality of symptom, basically. So let's talk about it. So first he sees this. He says that strength, basically the strength of, I will read directly from the preface itself. The first paragraph says, the strength of a chain is equal to of its weakest link. Means a chain, like you have a chain, the strength of the chain depends on the weakest part of that link. Wherever the weakest part determines the strength of the chain, basically how weak or strong it is. The value of person's life may be equal to that of the weakest organ. So value of a human life depends on the weakest organ that he is carrying on. Lungs, kidneys, heart. Which organ is the weakest right now? That determines the value or the strength of that individual or the patient. Here a particular organ is equal in importance to the entire organism. And that's how he says that here the weakest organ is actually as important as the entire organism. So when you're treating and you find an organ is completely damaged or it is gone in turmoil, in the entire part, that part is so weak, it has to be considered because it is of prime importance. It is very important, as much as important that little organ is as to the entire body is. And that's how the role of organopathic drugs comes into picture. And that's why it is so important to consider the organs that are damaged, organs that are weakened. We need to help them. We need to give remedies to boost them, strengthen them. Let's go ahead. Even where the tissue state of the entire organism is everywhere equally bad, it may be life-saving act to relieve a particular organ that first gives away. When he says that beautifully, when the entire organism, all the organs are damaged, like 3, 4, 5 organs are damaged or they are dysfunctional or some problem is there. He says the first one, which is almost going to die, first save that. It exactly reminds me of the patients who are being handled in ICU. When people go into multi-organ failure, how does the allopathic system work? Actually, it looks at lungs are deteriorating, heart is kidneys. So they try to address the organ specificity. That's what is called specificity of seat of action, and that's what he says. So in critical cases, of course, your constitutional remedy, your totality is important, but you have to be vigilant enough. You need to have an allopathic mind where you're thinking about the organ. Hence, investigation is important. Blood test important, sonography, MRI, CT scan, everything has to be done. The urine examination, the parameters, electrolyte, you should do it, because then only we can really help the patient. In many times it happens that pathologically we are so weak, homeopaths, that we don't think about the organs or the systems that are being affected. We might be giving the right remedy in the terms of constitutional, but that does not always work. That is the reason. So it all depends on the case, the type of case you're handling. So in deep pathological cases or in critical cases, even if you are trying to do palliation in a case, it is very important to have this acumen of an allopathic mindset in a homeopath, so that you think about the organs, you think in terms of investigations, you think in terms of blood test and everything, so that physiologically and pathologically your mind is active. You're thinking in terms of physiology and pathology, right? He says that itself is often at start of a particular organ. When a person dies, he doesn't die in general. That starts at the tissue level, starts somewhere, and then slowly the things die. That is actually local, then it becomes global. And if the part is saved in time, life may be saved or preserved. So he's of opinion, like suppose a patient comes and lungs are damaging, or you see liver is affected, liver is cirrhosed, or liver is affected, ascites is happening. You give your remedies, but then you have to do something to take care of the liver. You have to do something to take care of the liver. You have to think about the liver, the symptoms, the physiological symptom, the pathological symptom, the evolution of disease, whatever way. But you have to address that organ, because if that organ dies, slowly and steadily the entire organism will die. So that begins at the local level, the tissue level. But if that organ is saved, in a way, organ is saved, the life is saved. I'll give you an example. Again, from an allopathic perspective. A patient comes and kidney is completely damaged. Creatinine is rising, you are giving medicine, they are taking medicine, but creatinine is not coming down and complete kidney is damaged. If the same thing continues, you know what happens in dialysis and the problems with dialysis. But they say, okay, do transplant. I'm not here talking about that you do transplant or you don't. I'm just trying to make a point. A time can come when complete kidney is damaged and the patient goes for transplant. For next 5 to 10 years, 15 years, they live a fairly good life on a maintenance therapy. Knee joint, right? Knee joint. When it is completely damaged or cartilages are rubbed and completely erased, it's damaged completely. There's no synovial fluid left. Complete osteoporosis there. You cannot do anything, right? Organ damage, and then what do you do? What allopaths do? Surgeons remove and they do knee transplant surgery. The lady lives for next 15 years walking. So what is this? We have to understand this. I'm not saying we have to go and become knee surgeon, no. But yes, from a homeopathic perspective, what are the things that we can do when a pathological case or difficult cases come? So we as a homeopath have to start thinking like an allopath also. Homeopathy is there, homeopathic skills and mindset is there. But along with that, allopathic mindset has to come in. We have to start thinking about organs, right? The physiology and pathology is very important for that. In acute process, the value of a particular organ strikes even more important. One after every forcibly. They may be needed. They may not. We don't need any constitutional treatment. That's what he's trying to say is that people say many times, I give a constitutional remedy, it will take care of everything. I'm also not of that view. You give a constitutional remedy, that's okay. But in acute processes, you have to take care of it. You have to take acutes and manage it with homeopathy. And when you start managing with homeopathy the acutes, that's how you help the vital force to regain its strength. And once it regains its strength, in every acute you manage it. That's how you take the healing process ahead. Now comes a very important point. He says, what exactly is organopathy? What exactly? What exactly is organopathy? He says organopathy is not like, suppose you take a substance and you apply on the hand, the physical changes, the physiological changes or the chemical changes that happens on the skin or the superficial level, that is not organopathy. Somebody is having coryza, you give some astringent and it stops. That is not organopathy. And what is organopathy? Like somebody is having stuffed nose, you give Otrivin. Oh, you say, oh, see this Asthalin. Oh, this is organopathy. It acts on organ. That is very superficial. So what is organopathy? What is organopathic drugs? What does mean that? So he says organopathic drug means when you give that drug, it will go through the blood and it will select it will go and exactly go and attack or work on the organs. It will find out its organ. That is an organopathic drug. What does that mean? There's a word you might have heard, elective affinity. You know, this remedy has got elective affinity. Have you heard this remedy has got selective affinity? Have you heard about that? Selective affinity? Have you heard about selective affinity? No. It is said elective affinity. So what is the definition of, like, what is the difference between elective and selective? Elective is, I'll read exactly what the Google means. Elective affinity, like elective means the power to choose by yourself. The power to choose by yourself. Selective means someone else chooses you. For example, you fill a form and you select 4 colleges. Out of that 4 colleges, there are thousands of students. They select you. Okay, you come to this, or you come to this job, you come to this education system. They selected. But when you go, like you go in a mall and you select what vegetables you want, what clothes you want, you select, like you have the power. Means when we say organopathic drugs, it is not just superficially acting on the organs, you apply on the tissue and it acts. No, it is not the physical or the chemical changes that it brings superficially, but means organopathy means it has got elective affinity. Elective, it has got a power of choosing, going into the bloodstreams, going through the process, going through tissues and everything and choosing and finding out its organ and working on it. So it is a proper science. The organopathic drugs that we use is a proper science. That's what he's trying to talk about here, you know. So it is actually, he's trying to make a point that it is not a superficial remedy that you're giving. Oh, liver, give chelidonium. Oh, berberis for renal. No, it is not that. In that way, if you practice, then there's a big problem. You have to understand. Like in homeopathic drugs that we give, we say it has got, you know, elective affinity for this, or we know that it is going very deeper into the nerves and into other places and affecting the entire organism. So it also, organopathic drugs also work in that fashion. Right? Now I will read something very important about organopathy and what was his view. So now people who are following organopathy or Bernett will say, yes, see, it is so important. It is so important. The problem is we become fanatic followers. Whatever we are fascinated with, we just feel this is the only truth. And for a long time, I also felt that Bernett was just the promoter of organopathic drugs because he was a follower of Rademacher, who was a follower of Paracelsus. And you can see in his prescription how important the way they had a Cooper T Club, the way, you know, Clark's he uses, what Clark talks about. They all talk about organopathy. So now this is very interesting, and actually this entire talk was made for that. At the end I'm talking. So I will read first and tell you what was his objective thinking about totality of symptom remedies or remedies given on homeopathicity. So he says, I do not regard organopathy as something outside homeopathy. So first of all, you have to understand that organopathy is not something outside of homeopathy. Organopathy is a part of homeopathy. Even when you read homeopathic drugs, maybe you read from Kent or Clark or big books, They still talk about the pathophysiology. They still talk about the elective affinity of this. I can cite you an example. I just remembered once when I was working with my seniors, once an idea came to me, just thought came to me that thrombocytopenia purpura, this is a drug, this is a disease, and we have seen this disease getting cured and or at least maintained with homeopathy. Wonderful. Like I have got a couple of cases where completely resolved, patients completely resolved, especially children. And then I started looking at other people's cases also. And I started asking which was the remedy, what was the remedy. And you know what? You can do this exercise and try and find out. The majorly helped remedy is phosphorus. I'm not saying it is specific, but I'm saying majorly helped remedy is phosphorus. Other remedies which I found out which helped was crotalis, lacasis. And when you see and read these remedies, all remedies and many more are there, but all the remedies which has got lot of effects, a direct effect or elective effect on blood, especially platelets, where bleeding is a part of it, elective affinity to the system, these drugs have it, the sphere of action have it. So to say that organopathy is a different way of thinking, no, it is a part of homeopathy. Borax understanding is a part of homeopathy. The only thing is there is a diversion. That people have diverted it because some people are fanatic about homeopathicity. Some people are fanatic about like totality of symptom. Some people are fanatic about mother tinctures and giving 2-3 remedies. So we have to understand it properly. Okay. Now what he says, I do not regard organopathy of something outside of homeopathy, but as being embraced by and included in it, though not identical but coextensive with it. It is not identical, yes, but it can go together. If you listen to my talks in YouTube, the first video where I said Kent and Bernett, like James Crompton Kent, James Crompton Bernett, sorry, and Kent and Bernett, they look different. The philosophies look different, but actually, they converge at many points. If you read Kent's lesser writing, you go back and read all the cases, you will understand that in many cases, Kent did something which he did not propagate it. So where he got stuck, he used organopathic drugs, he used specific drugs. And when you read Bernett, you find that many places he was using organopathic drugs, but many places he used totality of symptoms. He used indicated symptom. Where he got modalities, he prescribed on modalities. So my dear friends, to become a good physician and to become a good healer and good ardent student of homeopathy, we have to understand that these both terms converge. It is not different. And now how nicely he says. I would say organopathy is homeopathy in the first degree. Organopathy actually is homeopathy in the first degree. Why? I explained you about the elective affinity. What is organopathic drug? It has a power. It goes inside and chooses. It has got a power like similibus kind of thing. And finally, I would emphasize the fact. Now here comes a very important point. That where the homeopathic similimum agent covering the totality of symptoms, where the homeopathic similimum agent, maybe you came through a system, you came through your method, you came through a totality, you came through a general symptom, you came to the mind symptom, a homeopathic similar remedy came up covering totality of symptom and also underlining pathological process causing such symptoms. Means you found out a remedy through totality of symptom and also the symptoms which are being coming from the pathological process. You combine it and you got a good totality with rubrics and mathematical understanding. Can be found there. Listen to it. I will read exactly what he said. I don't want to add my words. Their organopathy either has no reason or justification at all, or it is only temporary service to ease the organ in distress. So he says that when you find a remedy, when you take proper case, you call it a constitutional drug, right? We call it a constitutional drug. So if you find that remedy where the basis of prescription is totality, based on general symptoms like what Ken says, based on the modalities, the concomitants, and also it covers the symptom of the organ, right? That in that scenario, there is no need of giving any specific organ remedies. There is no specific of giving any drugs in that way, right? So this conflict which is there with everybody, in fact today after reading this I got resolved, because I also was of a mind that yes, Bernett was completely an organ prescriber, but kept changing it. Though whenever I was working on his cases, I realized at many places he was giving on symptom totality. He had an understanding of other things also, yes, definitely. So what is my learning from this? I'm so happy to share this, because my learning is we have to understand the organopathic part of the remedies, the way of prescription, and also the homeopathic part. The day when we can converge it together and know judicially when we can use it. The sense comes that when I have to use this and when I have to use this. When that sense will come, I think we as a homeopathic doctors can help big range of patients who are there. You know, our spectrum, our range of cure, or maybe range of helping the patient suffering individuals can widen up. So I'm here with it. Thank you very much for being a patient listener. I hope this makes sense what we talked, and I'll be coming up with more such videos, and we will be discussing some very important topics, especially about homeopathic practice. Thank you very much.